Okay, let's see. A couple little housekeeping things. Doing these YouTube videos with my friend Amanda Rideout, health coach Amanda Rideout. These are YouTube videos on skincare, and some of you have already seen those. There is, we're going to be putting one out. We're trying to do them every Friday. We got one coming out tomorrow on vitamin C, topical vitamin C, which is one of my favorite active ingredients for the skin. And let's see if there's anything else I want to tell you. I went to see Dr. Wallach yesterday. Dr. Wallach was in Denver, and he was in rare form. If you haven't seen Doc speak yet, he is just an absolute unbelievable wealth of information, of anecdotal information, of scientific information. He's an expert in anthropology and sociology. He's got all kinds of historical tidbits to share. And, of course, he's got a super unique and idiosyncratic and very effective take on how nutrition works in the body. He did a whole thing yesterday on the whole cholesterol and fat hypothesis, the failed saturated fat, cholesterol, and heart disease hypothesis. How many of you guys caught the cover story of Time magazine this week? I'd love to hear what your take is on that. Time magazine actually had a cover story. The cover story says, "Eat butter," right on the cover. Show that to your doctor, your margarine-pushing, cholesterol-drug-dispensing heart cardiologist doctor. Show him this article on how you eat butter. By the way, Doc Wallach's got a whole take on the really kind of insidious nature of the cholesterol and saturated fat hypothesis, the manipulative nature. Turns out that a lot of the doctors who are promoting the fat hypothesis, including Ansel Keys, who is the father of the saturated fat hypothesis, were on the take. They were on the dole. They were being funded by Crisco and Procter & Gamble and all the original hydrogenated fat manufacturers. Did you know Crisco, by the way, its original use, Crisco shortening, its original use was as a machine lubricant. And when they found out that there were better machine lubricants that they could use, they decided that they could use Crisco for food because it looked like lard and it tasted like oil. And that's what Crisco is. And today we don't, Crisco's a brand name today, but there's all kinds of generic forms of hydrogenated oil, Crisco-like substances. Anyway, don't buy into the modern medical model. Is the moral of the story. Don't buy into conventional wisdom about health. And that's the moral of the story. So, anyway, we're talking protein, we're talking amino acids, we're talking specifically the super-duper amino acid, arginine, the healer, the youth amino acid, the repair and growth amino acid, the blood sugar stabilizing amino acid, the anti-aging amino acid. What more could you want from an amino acid? Arginine is the most important amino acid for critically ill patients, and it has a special role to play when it comes to helping patients who have liver disease. Yesterday, we got a call from a guy who had questions about hepatitis C. Hepatitis C is an inflammatory liver issue that's associated with a virus. Hepatitis is basically a liver disease. Hepa means liver. Titis means inflammation. Hepatitis is just an inflammation of the liver. It should come as no surprise to listeners of this program that liver diseases of all kinds is somewhat of an epidemic. It is an epidemic. So hepatitis is Latin for inflamed liver, and while most medical professionals will tell you it's a virus that causes it, it's actually a generic term that refers to liver inflammation. In addition to viral infections, and there's various viruses that can cause these kinds of inflammatory problems in the liver. In addition to viral infections, alcohol can do it, drugs can do it, toxicity can do it, mushroom poisoning can do it, autoimmunity can cause liver inflammation, i.e. hepatitis. The viral forms typically will get the designations hepatitis A, hepatitis B, C, D, and E, but there's other viruses that can cause hepatitis. The designations A, B, C, D, and E refer to viruses that supposedly come from food and from human waste. The way I look at it, because there's no antiviral medications that are really very effective when it comes to getting your liver healthy again. If you're dealing with hepatitis, it doesn't really matter where the hepatitis virus comes from. What's more, if you have an inflamed liver, which they diagnose by elevated liver enzymes, if your liver enzymes are elevated, that just means your liver cells are dying and they're exploding and they're spewing their enzymes out into the blood. That's what elevated liver enzymes mean. It means that you have dead liver cells or dying liver cells. If you have an inflamed liver, unless you have your blood checked for specific viral antibodies, nobody's going to really know if the inflammation is related to a virus or not. And even if there are viral antibodies, because there's no real way to kill a virus with medication, although these days doctors love to put people on interferon, which can cost thousands of dollars per dose. It doesn't even work very well, except maybe to suppress the signs of the disease. Even worse, many people get their hepatitis back when they stop their interferon. In any case, because you can't really kill a virus with medication, it makes so much more sense to figure out how to strengthen your liver, how to build your liver up, what your liver even does. We need to know what the liver even does so we know how to build it up. You take interferon, you get to spend thousands of dollars a dose on your interferon, and as soon as the interferon wears off, you get your hepatitis back. And the body makes its own interferon anyway. The real question to ask if somebody has hepatitis is, why is the body not taking care of the virus by producing its own interferon? Why is the body's immune system suppressed? Why is the liver so toxic that it can't do what it's supposed to do? And why is the immune system so burdened that it can't take care of viruses? Pretty much everyone over the age of 35 or so is going to have some signs of liver inflammation. It's just how we live our lives in the 21st century. And as we get older, liver inflammation increases, fatty liver increases, non-alcoholic fatty liver disease, as I say, is almost an epidemic. So even though hepatitis is supposedly a viral issue, there's so much more we can do. There's so much we can do to take care of our livers, to protect our livers, and a lot of it has to do with protein and amino acids. All right, hang tight. We're coming back with more good health information on the bright side. Don't. Okay, 855-660-4261 is our number. We're talking about arginine, very important for a lot of things, but it's important for liver health as well. Yesterday we talked to a guy about hepatitis C, so it got me thinking about liver health issues. Just reading yesterday, America's liver disease epidemic. Are you at risk? A new health epidemic is sweeping the country, and doctors warn it poses a grave threat to millions of Americans. They're calling it NASH now. We called it, in pharmacy school, we called it non-alcoholic fatty liver disease, NAFLD. The new designation is NASH, N-A-S-H, non-alcoholic steatohepatitis. How do you like that? It's a form of hepatitis, inflamed liver. Steato means fat. Non-alcoholic steatohepatitis, S-T-N-A-S-H. Steatohepatitis is fatty liver, inflamed fatty liver, non-alcoholic inflamed fatty liver. Any case, according to the article here from Newsmax Health, over the past 2 decades, the incidence of fatty liver disease has doubled in 20 years. It's doubled. Now, and they say in advanced cases you need a liver transplant. NASH is becoming the next big epidemic to hit America, says Anurag Maheshwari, MD, a liver specialist, liver genius. It's becoming the next big epidemic. Is he telling people, oh, make sure you got your vitamin A, make sure you stay off of fructose. And by the way, there's a huge fructose connection to liver disease. Could our epidemic of liver health issues be related to the glut of products that contain high fructose corn syrup? Maybe. Sounds good to me, right? High fructose corn syrup has a toxicity profile that's very similar to alcohol. I'd say it's a pretty darn good bet that at least has something to do with an epidemic of liver disease. The point is here, we're not condemned to our diseases, folks. These are lifestyle issues. These are choices we make. If you've been diagnosed with hepatitis C or any other hepatitis, you have control, because bad living is the core of these disease states. Hepatitis is supposedly a viral issue, but how many people who are diagnosed with hepatitis are actually dealing with a hepatitis virus, with hep A, B, C, D, or E? How many people who supposedly have hepatitis C actually had their blood tested for antibodies to these viruses? Fact of the matter is, an inflamed liver, whether it's caused by a virus or not, has a very important connection to lifestyle choices that we're making. If you've got hepatitis, if you've been diagnosed with hep C or A or B, your best bet is to be kind to your liver. If any organ bears the brunt of a toxic lifestyle, it's going to be the detox organ called the liver. Next to the heart and the brain, the liver is probably the most important and the most multifunctional structure in the body. It's the largest structure in the body, inside the body. The skin is technically larger, but that's on the outside of the body. The liver is the internal organ's largest, it's the largest organ in the internal environment of the body, and has a role to play in almost every single thing that the body does. If you have any health challenge, especially long-term degenerative disease challenges, you can rest assured that you probably have a liver health issue going on as well. So why do you suppose liver diseases are becoming such a problem? Well, in my humble opinion, blood sugar issues are paramount. Dysglycemia, that's a fancy way of saying messed up blood sugar. DYS, dys means messed up. Glycemia is Latin for blood sugar. Dysglycemia, messed up blood sugar, and considering the liver is the, capital T, capital H, capital E, the main sugar processing organ, I'd have to tell you that if liver disease is an epidemic, sugar probably has a role to play. Our excess ingestion of sugar has a large role to play. Could liver disease have something to do with obesity? Well, considering that the liver is the main organ in the body that's charged with processing fat, once again, I'd say obesity probably has something to do with our epidemic of liver disease. It's hard to say what the most important function of the liver is, but probably a good case could be made that the liver is a digestive organ primarily. After food is broken down in the stomach and goes into the intestine and then it's absorbed into the blood, the next stop is the liver. In fact, everything we eat, when we're healthy anyway, has to be processed by the liver. The more toxicity that's coming into our body through food, the more toxicity the liver is going to be dealing with. Now keep in mind, folks, the liver is amazing when it comes to detoxification. It has got a detoxification system that would take a huge building to fill up if it was done with machinery. The detox system in the liver that's made up of enzymes that breaks down poisons is absolutely mind-boggling. It's intelligent. It can adjust. It can learn. It can upregulate itself when there's more toxins present. You'll get more detoxification enzymes. Alcohol is the major liver toxin. That's what most people know of when they think of liver toxicity. But foods can be equally problematic. The more food poisons we're ingesting, and that includes McDonald's and Marie Callender's and Ruby Tuesdays and French fry grease and hormones and meat and milk and preservatives and antibiotics, the more of these things we're eating, the more work our liver is going to be doing. And because the liver is also responsible for processing prescription drugs, the more medications we're on, once again, the harder our livers are going to have to be working. This isn't going to show up on the side effect profile, by the way. You can go through your side effect profile, and you really should if you're on a prescription drug. It's probably a good idea to read the side effects and the adverse effects on the little package insert, which they don't like to give you, but you should insist on getting the package insert from your pharmacist. I remember I used to hand out the package insert when I was a pharmacist, and Kmart didn't like that very much at all, and they warned me not to do it. And the doctors didn't like it either. They told me, what are you doing giving my patient the package insert? You should know. I gave them the package insert because I thought the patient should know what they're getting themselves into. Not that people really read the package insert, but you should. The point is you can read your package insert, and liver issues aren't going to show up for the most part unless your drug specifically affects the liver, like statin drugs, for example, specifically affect the liver. But for most drugs, they're not going to tell you that your liver enzymes are going to be compromised and your liver's abilities to detox substances and process foods and clear out food poisons is going to be compromised. And now you're going to run higher risks for all other diseases. This is a hidden problem with prescription drugs. The more we take, the harder our livers are going to be working. And the liver processes sugar. So the more carbs we're eating, the harder our liver is going to be working. This is a huge, huge problem, folks. There's two major types of dietary sugars. You got glucose and you got fructose. Those are the two main kinds of sugars. Ordinary table sugar is a combination of glucose and fructose, and the average American is ingesting half a pound of this stuff a day, and a lot of it is fructose. All right, got more to say about this. In fact, we'll talk about this tomorrow, this very important connection between sugar and the liver and also arginine and what you can do. Arginine's got some really interesting roles to play when it helps the body process sugar. All right, I'm Pharmacist Ben. We're coming back after this. New article from Medical Hypothesis regarding long-term statin therapy. Are we trading stronger hearts for weaker brains, apparently? Well, cholesterol is a major part of brain health, a major part of brain cells. Are we trading stronger hearts for weaker brains? I don't think statin drugs are going to give you a stronger heart anyway. Statin drugs simply lower cholesterol, and as we were talking about at the beginning of the program, this cholesterol hypothesis, this idea that you make too much cholesterol and cholesterol creates clots in the blood, is really just a hypothesis. It's never really been shown to be true. So statin drugs, regarding long-term statin therapy, are we trading stronger hearts for weaker brains? No, we're not, because we're not getting stronger hearts for weaker brains. We're getting poisoned hearts, and and poison bodies for weaker brains. If you're on a statin drug, you guys, I am telling you, nothing says medical hypnosis, entrancement by the medical model, more than taking a statin drug, than poisoning your liver, poisoning your body's cholesterol-making system, just because your doctor told you, or some representative of the medical model who's profiting off of our ignorance has told us that poisoning the cholesterol system of the body is somehow good for the heart or good for anything in the body. It's not. There's no drugs that are good for anything in the body. Yes, there's drugs that you need for an emergency, pain pills specifically, and antibiotics, but that's about it. I can think of no other prescription drug that can help you except for maybe in an emergency situation if you have a hypertensive crisis or a blood sugar crisis, just to take something for a short term. Other than antibiotics and pain pills and emergency medication, there is zippo, not a benefit to long-term prescription drugs, and there's a lot of there's a lot of toxicity and side effects, and as we said earlier, they don't always show up on the side effect or adverse effect profile that is on the package insert for these drugs. All right. We'll continue talking about liver health. Tomorrow I'll tell you about this whole sugar connection to liver health and liver disease, and then we'll talk about how you can use arginine, really neat amino acid, not just for the health of the liver, but also for keeping yourself from sugar toxicity. Lots of other things associated with arginine supplementation. I personally take about 5 grams of it every day. Okay, our number today is 855-660-4261, and we do have a couple lines open for you. Let's go to Texas and welcome Janis to the bright side. What's up, Janis? Good morning. Good morning, Janis. Going once. Hey, Janis, what's going on?
Hi, I have a daughter that has been diagnosed as having seizures.
Okay.
And they put her on Keppra. That's the only thing that she's taken. She's usually not taking anything at all as far as pharmacy.
How old is she?
About 40, 42, something like that.
Okay. And she never had epilepsy? She just all of a sudden started getting seizures?
Yes, she just, all of a sudden, she even died once. Somebody had to resuscitate her.
Oh, my goodness. Did she have a near-death experience?
During a big divorce she was going through.
Did she have a near-death experience?
I don't know. I haven't asked her about a near-death experience.
Do you know about those?
Yeah. I've heard about them, and I just didn't think of it.
I always think of that when I hear somebody almost died. Anyway, so she went through a divorce, and that's when the seizures started to happen?
That's when the seizures seemed to start happening, and she's had several of them.
Okay.
It was while she was in, it was a very high-profile divorce.
Okay.
And it was while all the lawyers were in there, and I told her, what if it's all those computers in that room?
No, come on, Janis. She's
I don't know. You get weird things. But the other thing you need to know is that she has an alcohol problem.
Well, sweetheart, listen, there's all these other things happening. So, of course, she's got the epilepsy, and this is an important point. You know, we see these symptoms that are dramatic, like seizures, right? And then we assume that the problem is a seizure disorder. But then you start to probe and start to get underneath, and you see that there's stress, psychological stress. You see there's alcohol, and I'm not beating anybody up for alcoholism or drinking alcohol, but I'm just saying underneath our apparent symptomology is where you're going to find the problems. But the doctors aren't going to probe underneath there. Now, alcohol is going to affect the liver. Alcohol is going to affect the brain. Alcohol is going to affect her body's ability to process foods and detox. I'm sorry, we got some background noise there. Janice, are you vacuuming while you're talking to me or anything?
No, I'm not, but there is an air conditioner.
Okay. Well, that's better if you can just walk away from it. Anyway, let me give you some ideas, okay? First of all, I don't want to tell you that it's just strictly a nutritional issue, because it does sound like that there's some psychological things going on, and I haven't said this in a while, so I'll just say it again. Even though we talk about the physical dimension of health and wellness are multidimensional, and disease is multidimensional. It starts off spiritually. That means somehow we have this sense of abandonment, sense of lack, sense of something missing in our lives. This is what spiritual crisis really is about. Something is missing out of our lives, and we don't know what it is. Then there's the mental elements. The thoughts we think affect our health. And this is not airy-fairy, new age gobbledygook. Every time we think a thought, it gets turned into a hormone, and then our body gets manufactured from that hormone. Same with emotions. So mental and emotional elements, in addition to the spiritual elements or dimensions, are very, very important to recognize. And we don't talk about them on the bright side, because this is a program that's mostly about the physical side of things and the nutritional side of things. But I would be remiss if I didn't tell you that there's a spiritual component to health, or the lack thereof, and a mental, emotional component to health or the lack thereof. But from a physical standpoint, there's tons you could do. First and foremost, obviously the alcohol is going to be a problem, so she should be weaning herself off of that. But underneath alcoholism, you find emotional and mental and spiritual crisis. So you got to address all those dimensions. You can't just say get off alcohol. I forgot who I was talking to earlier. I was talking to somebody. When you have an addiction to something, that one of the fastest, easiest ways to wean yourself off of whatever you're addicted to, or to eliminate addiction, is to find something else to be addicted to, at least temporarily. Find something better to be addicted to. So if anybody's addicted to alcohol, for example, get addicted to exercise, or get addicted to charity work, or get addicted to some kind of personal mission that you have, or get addicted to something that's better than, get addicted to reading, get addicted to self-help, get addicted to God or spirituality, get addicted to something else that's beneficial for you. That's the easiest way to wean yourself off of a negative, harmful addiction. No addiction is good, but it's a lot better to be addicted to self-help or spirituality than to alcohol. So weaning yourself off alcohol is important. From a nutritional standpoint, there's tons you could do. Look into the ketogenic diet. That's the first thing you want to do for any seizure disorders. The ketogenic diet is a low carbohydrate, and they call it moderate protein and moderate fat. I'm not sure what they mean by moderate, but just make sure you're eating more protein, or she's eating more protein, more fat, and coconut oil is a wonderful, wonderful fat for dealing with epilepsy and seizure disorders. It is really very helpful, and it's also helpful for the ketogenic diet. And then as far as nutritional supplements go, taurine is very important. The amino acid taurine has brain stabilizing effects. It has actually been used to treat epilepsy, taurine, 100 milligrams, maybe 3 or 4 times a day, or anywhere from 2 to 4 times a day. Taurine is actually used in Red Bull to kind of calm the body down from all that caffeine. It has a calming effect on the body. The B vitamins are the brain vitamins, B for brain, B for building also. So the B vitamins will help build things, and they're also very important for brain health. Get on the Beyond Tangy Tangerine. That's one of the best things, one of the most important features of the Beyond Tangy Tangerine is the fact that it's liquid B vitamins. And remember, every time you urinate, you're losing your B vitamins. You're losing your water-soluble nutrients. And the water-soluble nutrients, the B vitamins and the electrolytes and also vitamin C, are highly electrical. And seizure disorders are an electrical issue. So make sure she's sipping on the Beyond Tangy Tangerine. Sugar will deplete the body of B vitamins. It can cause problems with seizure disorders, especially when insulin goes up and you go into low blood sugar. So making sure she's keeping her carbohydrate intake down is also important. And after you eat carbohydrates, or after your daughter eats carbohydrates, make sure she's using some B vitamins to help stabilize the blood sugar, help the body process the sugar. Hang tight, Janis. Got a couple more things to say. All right, we're back on the bright side, talking to Janis in Texas. A couple more things I want to tell. Janis, you there, ma'am?
Yes, ma'am.
Oh, sir. I'm a sir. You're a ma'am. I want to just tell you a couple things here, Janis. Actually, Janis, let me ask you something. And I just want to know. I'm not trying to be attacking here, harassing you or anything. I just really want to know. If your daughter's drinking alcohol, and she's got stress in her life, and then she has seizure disorders, why would she go to a doctor and take a prescription medication that poisons the brain? That's how your Keppra works. It actually poisons the nerves. Instead of focusing on the things she can control, like the stress and the anxiety and the alcohol and the other things that she might be doing. And I'm not attacking you. I just really want to know. And obviously she's your daughter. She's not you. But in your mind, in your opinion, what do you think she's thinking?
Sometimes I wonder if she's thinking.
Okay.
She is a vegetarian.
But why would she go to the doctor before she focused on the things she can control, in your opinion?
I don't think she knows what she needs to do to control.
Okay.
I don't.
You think she just felt desperate and just didn't know what to do?
Well, when you've ended up in the hospital and died and everything, I guess a doctor says you have to take this forever.
You listen.
You listen or you die.
All right.
As far as she thinks. And I know that calling you is a way to find out what she can do instead of Keppra. And
well, I'm just going to give you common sense ideas, okay? So this isn't even really science or anything technical. It's just common sense. Alcohol puts a major stress on the body. Her divorce probably didn't help, and I'm sure she's doing other things as well. By the way, if she's a vegetarian, the chances are really, really good that her blood sugar is whacked out too. Unfortunately, vegetarians who aren't really paying attention to how they vegetarianize are prone to eating lots of grain and lots of sugary kinds of foods. So chances are her blood sugar's whacked out also. So all the things I just told you, I told you before the break. Number one, the ketogenic diet, which is a low carbohydrate, moderate protein, moderate fat diet. Coconut oil. Make sure she's using taurine, 200 to 400 milligrams a day. Make sure she's using the B complex all day long in the form of the Beyond Tangy Tangerine. She should probably be getting on the Healthy Start Pack as soon as possible. And then last but not least, she doesn't want to go into low blood sugar, but the less she eats, if she can keep her calories down, that's going to allow her body to heal and recover, and it's going to reduce any of the likelihood of this high blood sugar, low blood sugar roller coaster that can initiate seizures and seizure disorders. So tons of stuff you could do. And when she's on the Healthy Start Pack, by the way, I would be doubling up on the essential fatty acids, which are super duper important for brain health. And if she wants to live a good, long, strong, healthy life, she'd be very wise to get off the brain poisoning drug toxin that her supposed healthcare professionals put her on, that Keppra, which literally works by poisoning nerve cells in the brain, dumbing down nerve cells in the brain. That's its mechanism of action. Got to move on. Janis, anything else you want to say?
Just that she has every single reaction to that Keppra that are side effects. She has every one of them.
Oh, well, I don't know what to tell you on that one, Janis. Have her wean off the Keppra and do everything I just told you, and she should notice some significant difference.
Is it possible to get a tape?
All the programs are archived. You can listen to them as much as you want, and they're at brightsideben.com. Hit the archive page, and they put the shows up a couple hours after we do them live. They put all the shows up, and you can listen to three and a half years worth of programs as much as you like. There's also another website, benfuchsarchives.com, where you can listen to all the programs, and you can actually search by specific topics. Okay? Thank you so much for your call, Janice. God bless, and good luck with your daughter. I hope everything works out. Okay, let's go to Canada and welcome Robert to the bright side. What's going on, buddy?
I had a small cancer removed from my hand. It was the size of a dime.
Okay. And, skin cancer?
Beg your pardon?
It was a skin cancer, right?
Yes.
Okay. You want some help with that?
Yes.
Okay. Go ahead.
Well, it swelled up tremendously for a couple of weeks, and it's still swelling so much I can't hardly move my fingers.
I'm sorry. Post-surgery?
Yes.
It's okay. So here's the deal. Number one, cancer only exists in a toxic environment. A cancer cell is a cell that doesn't know what else to do, so it is reverted back to a primitive way of growing. Cancer cell's like a primitive cell. In fact, there's two types of cells. You got old cells and primitive cells, I should say, and you got modern cells. The modern cells are called eukaryotes. The primitive cells are called prokaryotes. Pro means before or prior or beginning. Where a cancer cell is a cell that is reverted back into a prokaryote way of living, of dividing, of growing, and it only occurs when it's desperate, when it's at its wit's end, it doesn't know what else to do. So the key to dealing with cancer is to address toxicity in the body. Now, lack of oxygen can amplify the problem, and lack of nutrition can amplify the problem. So between those three elements, you can help you prevent cancer and ideally, under ideal circumstances, even reverse it. So what are these three subjects or three topics, and how do you address them? Number one, you got to make sure that any toxicity in the body is eliminated in the sense of, number one, not putting it in, and number two, helping your body process. Moving your lymphatic system is great, a great way to improve detoxification, and that means getting on a treadmill, walking, getting on a rebounder, anything you could do to move your body around. Secondly, you want to make sure that you're helping your liver do its work. The liver is the prime detox organ, and as we said earlier, if you're on prescription drugs, that's going to burden the liver. If you're eating a lot of sugar or drinking a lot of alcohol, that's going to burden the liver. And if you're getting in poisons through the digestive tract, that's going to burden the liver. So making sure you're cleaning up your food, eating less food is a great strategy. Eating simple foods, linking up digestive problems to foods and then eliminating those foods. Anything you do for the digestive system. And then using digestive system support. The Z Radical from Longevity is wonderful. The Biolumin Nightly Essence probiotics will be very important for you. By the way, the Z Radical has got anti-cancer benefits in addition to helping improve digestive health. And then also using the digestive enzymes, the ultimate enzymes after meals, and I'd probably be using them on an empty stomach. That might help the inflammation too. using digestive enzymes on an empty stomach can be very helpful as an anti-inflammatory. And then thirdly, keeping your blood sugar stable is going to be important. Use the sweeties from Youngevity. Make sure you're staying off of refined sugars and carbohydrates and trying to get in more protein. And then making sure that you're oxygenating is also going to be helpful for you. Cancer hates oxygen. And cancer cells actually thrive and grow in a low oxygen environment. So making sure you're doing your deep breathing techniques, inhaling as well as exhaling. Inhaling as well as exhaling. By the way, the relaxation response that counteracts the stress response occurs on the exhale, not on the inhale. So making sure that you're exhaling correctly, that'll also help you detoxify, is also important. And there's a couple of nutrients that are specific for helping fight cancer. Selenium, the ultimate selenium from Youngevity. I'd be doing 400 micrograms a day of that. Vitamin C is powerfully anti-cancer. You might want to consider, 5,000 milligrams, a teaspoon of vitamin C powder in divided doses. NAC, also known as NAC, has got anti-cancer benefits. I would be doing 500 to 1,000 milligrams of NAC a day in divided doses. And then, of course, your entire Healthy Start Pack is also going to be important. That's the Mighty 90 essential nutrients. Those are the basic nutrients. Last but not least, make sure if there's any kind of emotional or mental stressors going on in your life, you got to address those, and spiritual, of course, as well, because that can compromise the immune system. That is the body's ability to fight cancers. You guys, we get cancer all the time. But our body's immune system snips those little cancer pieces out, and then the cancer goes away. That's when we're healthy. That's when our body is resilient and vibrant and robust. But under conditions of degeneration, and under conditions of nutritional deficiency, and under conditions of lack of oxygen, and under conditions of stress and toxicity, our immune system becomes suppressed, and that does not occur. So making sure you're living a clean life, using the Mighty 90, focusing on digestive health and wellness, using the digestive enzymes after meals. These are all options for you, and none of them requires a doctor. None of them requires an oncologist. None of them requires a drug that's going to poison your body. That's the good news here. That's the bright side. That's why I call this program the bright side. Is you don't need the medical model to be healthy. Period. End of story. How dare the doctor insert himself? How dare the medical model insert himself into our personal lives in order to help us maintain our health? How rude, how obnoxious for him to stick it's like the old saying of the camel sticking his nose under the tent. How dare the medical model stick its nose under our health tent? It's our personal responsibility, and it's easy to do. It's our personal responsibility to stay healthy, and it's easy to do. Thank you so much, Robert. Appreciate your call. Got to move on. If we left you on hold, I apologize for that. I tell you guys, you got to call in early so we can get to as many calls as possible. All right, thank you so much for listening, friends. Tomorrow we'll continue talking about protein and the liver, and we'll talk about sugar's effect on the liver as well. Check out my website, brightsideben.com. Check out my blog, pharmacistben.com, and join the Brightside Ben team. Start yourself a Youngevity business and help spread the word about the power and importance of a good nutritional supplement program. That's all the time we have for today. I'm Pharmacist Ben. Thanks for listening. We'll talk to y'all later, folks. Have a wonderful, beautiful day. We'll talk to y'all later. Bye for now.